BMJ is defined by its mission to work towards a healthier world for all. We share that global endeavour with millions of readers working in clinical practice, research, education, government, and increasingly with patients and the public too. It's that mission which defines us, far more than the format of our content. After nearly 180 years, our print edition still thrives and has been joined by podcast, video, tweet, website, and live events. But as each of these formats gains ground or declines in importance, the things the BMJ cares about will endure. These are improving the creation and dissemination of research evidence, improving clinical education and practice, advocating for universal, equitable, high-quality healthcare, championing the health and well-being of doctors, and improving the social and environmental determinants of health.
At the highest possible level, the BMJ is all about making people's lives healthier. So we might work with the World Health Organization, we might work with big funders of health like the Gates Foundation, but ultimately the point is to put together content that will enable policymakers and clinicians around the world to make better decisions and improve the health of their populations. I mean, at the BMJ we're in a privileged position. I think we are able to come to work each day and think, what can I do today to change the world? What can I do today as an editor on the BMJ to improve the lives of people in any part of the world? And that's very powerful, that independence, that ability to ask the questions that other people are unable to ask, to give the less powerful a more powerful voice.
Our vision when we are selecting research papers to appear in the journal is to identify those that will be immediately relevant to what our general doctor readers do every day in the clinic. Also increasingly patient-centered. We're taking steps to involve patients in the journal.
The BMJ, as a global journal, is interested in research coming from all parts of the world. We're interested in questions that address issues that are important to patients or doctors anywhere in the world.
I think there's a lot of added value that we do in terms of improving a manuscript. Also try to remove every bit of spin from a paper.
We see research from all over the world and we encourage international submissions.
I don't only look at papers from China, also from around the world.
We think of analysis articles as scholarly debate articles or arguments with data. They're a forum for academics, researchers, doctors, policymakers, patients, even to air debate, challenge orthodoxy, air controversies.
When we're looking for education content, we're looking for content predominantly that helps jobbing doctors. They could be anywhere in the world and they could be from a number of specialties. They know how to do their job, but they maybe want to do their job more efficiently. And what we're trying to do is to find topics that help them do their job better, that help them have better discussions with their patients, more honest discussions.
We're the only leading medical journal that invests in quality journalism, and that seems like more important than ever before at the moment. We've got a rise in opinion over fact-based journalism.
We're, with that, trying to provide the context for a lot of the developments we report on, as well as reporting news. We're trying to get people to step back from the immediacy of kind of that daily, hourly cycle and provide some context for what doctors are learning about.
BMJ Opinion is our online platform for personal views or critical takes on a topical healthcare issue. What we're looking for is a clear and compelling point on a healthcare issue, but also a strong take-home message for practicing clinicians about how they can improve their practice. Social media is a really good way for us to promote our articles, but it's also a really great way that we can communicate with our readers. So we often get lots of reader comments, and it's a great way to engage with them. And it's been a way for us to engage with the patient community as well.
I think that scientists bring a different perspective. I think that understanding what it feels like to be a researcher that actually is submitting an article to a journal and understanding how much it means to get published in a journal like the BMJ. It's very important when you're dealing with clinical topics to be working with people who understand what it's like to be at the bedside. And then I think that the journalists bring another dimension altogether.
So open access is one big way that journals are changing, and the BMJ has been open access pretty much since the term was invented. So all our research is available for anyone to read. And the BMJ again has been leading the way with open peer review, letting authors know who has reviewed their paper, any conflicts of interest those people might have are fully declared, and even publishing the results of peer review alongside any accepted papers. We've been trying to push all these ways to improve what is put out as a research article. So the BMJ is unusual among research journals in also having a campaigning side. We really want to improve the way clinical research is done, but also the impacts that it can have in society. So we don't just want to publish research for researchers, we also want to have a broader impact than that. And it's been a major change to include patients in considering how we communicate with doctors, how we do research and how we publish the results of research, including having patients as peer reviewers. The history of the BMJ is as a parochial journal published in London, but our ambitions now are much more global and much more about having an effect on all those we work with and helping bring people along to a vision of a more transparent and equitable research enterprise.
The BMJ can be many things to its diverse audiences: an international journal, a member magazine, a think tank, an investigative campaigner, an educational resource, even a trusted and inspiring friend. Whatever the BMJ means to you, we invite you to share our mission and join us in working towards a healthier world for all.